Hello, this is Sumi Mundeshwar. I'm the Assistant Laboratory Manager for Bahrain Specialist Hospital. We tied up with the CrelioHealth LIS in 2004, and it has been a very wonderful experience using CrelioHealth LIS. We were on HIS before, and HIS has limitations, but the major features that we saw in LIS was that we have a laboratory dashboard. Being a laboratory manager, it gives me an overall view of a bird's eye view of the laboratory, of how many samples have been processed, what was the turnaround time, where we are lacking, where we can improve. So there is a lot of information on the laboratory dashboard. I think that is one of the key features of LIS, especially when it comes to laboratory management. I'm also a microbiology supervisor. So in microbiology, we had issues that our Vitec machine was not interfaced for many years in HIS, but CrelioHealth could interface our Vitec reports, and it just takes a click to transmit the report from the Vitec directly with the MIC values to LIS, and that has really helped us, decrease our turnaround time when it comes to releasing of reports. The second good feature in microbiology was, the Excel upload. So they designed the Excel for us where we can scan the barcodes, and they give us a code for each culture, negative culture, like A1 for no growth or A2 for no pathogens. So you just scan the barcode and you start putting your codes based on what reports we had. And once we do that, we just save it, and that Excel gets pushed to LIS. So we don't need to go patient wise, open the patient's result sheet and enter the result. And this was a major feature that we felt in LIS, especially in microbiology, because it used to take almost 2 to 3 hours for us to type these negative reports in the system. And with the Excel upload, it's just a matter of 15-20 minutes, and more than 50 reports get uploaded at a time. There are, of course, many other features which my colleagues will talk about, but third thing is that the Crelio team is very much open. It's an open system. It is AI integrated. So they are open to make the modifications or the customization that we are requesting them for. I think that's a key feature that that LIS has. We are very happy, and we'll be soon launching the mobile app for the clinicians. That is another key feature. There are some features for training of the technicians. That is also very easy in LIS. So we are very happy using CrelioHealth. Thank you very much. Hi, I would like to add few words regarding the inventory model that we signed up for. And we are still onboarding and ongoing training, but the key features that we noticed is that we can make purchase orders online. There is no need for any manual job. The purchase orders, we can track what is received in the laboratory and what is pending to receive in the laboratory. Then third thing is that we can have alert system for our inventory, which we can program in the system, which will tell us when our stocks are depleting beyond a certain level. That is very, very important as a laboratory manager, to make sure that laboratory inventory is at optimum level. Another feature is that it will help us understand the utilization of a kit. So if I have a kit of 10 tests, how many tests were done for a patient, or how many were wasted, or how many were used for controls. So that utilization of the kit, which ultimately will of course transcribe into, when we decide the cost of a test, we will know that a kit which is efficiently used can have a better price. It will help us understand the wastage of the reagent in the laboratory. That is one of the reasons that we signed up for the inventory module, and we are very, very happy to see if they will have the inventory dashboard. So these are the key features about the inventory module, and I highly recommend that people should sign up for the inventory module in February. Thank you.
I am Dr. Mary Jean. I am the consultant pathologist and the laboratory coordinator in Bahrain Specialist Hospital. We are happy to have CrelioHealth LIS, as it has made a major transformation in our laboratory information system. There are so many features, and some of them which really attracted me, some of the features that really took to our attention is the QC module, which we have, the barcoding system that is made us paperless and less cumbersome. We can monitor our TAT very quickly and easily and make the modifications and improve our services. We have the data that is so easily available and retrievable that we can also, which is useful for our lab audits. And there are so many features that make the laboratory management in a more systematic way, time saving and useful for our clinicians with the clinicians application, where our clinicians can be updated about their reports and also about the critical alerts. They can be notified, which makes them also useful for them, so that they do not have to make a call to the laboratory or waste their time, but can quickly react to the reports and help treat their patients effectively. We are proud users of CrelioHealth LIS, and we hope that we can work together hand in hand in the future also to use all these applications and the newer ones that you are bringing out. I hope we can make use of that, so that we as a laboratory can be useful in our services to the people and the patients and the customers around us. Thank you.
Hi, I'm Dr. Abid Hussain, pathologist at Bahrain Specialist Hospital. We have integrated our hospital information system with the laboratory information system LIS from CrelioHealth, and we are satisfied with their services and performance that are given to us. They have various modules assisting the lab perform in a very smooth way, starting from the sample collection till the report generation. The mobile app version of this makes it a very useful tool for a pathologist and the clinician to assess the reports even from distance and at different timings as well. I'm especially impressed by the QC module, where I can keep a strong eye on the QC when there is some violation in QC, and when there is a 2 standard deviation or more, I can control the reports from being released and I have a bird's eye on it. In addition, their inventory module keeps an exact track of the reagent used per test, and it helps us to know the exact consumption at the lab. I hope we will have a better coordination and understanding with the Crelio team and better services in future with further coming inspections and JCI accreditations as well. Thank you.